Hello.
Hello. I'm going to share my screen
Okay.
and see if we can see everything today. I could change my background today.
Yeah, I tell you, every time we get in, it's different. I still have all my stuff though, so
Okay, you can see that, correct?
yes, ma'am.
Okay, I'm going to see if we can.
It's still strange seeing December 3rd is the date. This year went so quick.
You can see the screen that has all the videos for selection, right?
Yes.
Okay. Okay. I never know how it's going to react. So,
No, that was pretty smooth today.
yeah.
Yeah.
Don't jinx it. Don't jinx it. I had to stop a timer. I think I'm developing arthritis in my right hand. Not what I want.
No. Okay, so my dog's ringing the bell. I'm sure it's just to eat, but she might need to go to the bathroom. So I'm gonna step away for a moment before we start.
Okay.
Good morning, everyone, and happy Friday. Welcome to our session 7, Project Firstline. Today, we will be talking about PPE Part 1, which will be covering eye protection. Again, thank you for joining us. As usual, if you can put your name, organization, and email in chat, that allows us to keep accurate attendance records, as well as it helps to build our database so that we can ship any resources to you as needed. So at this time, I will pass to Miss Nadine.
Good morning, everyone. I hope everyone had a great holiday and didn't eat too many carbs, although we seemed to carb overload at that particular holiday. Well, any holiday, actually. But that one is one of the worst. But we all enjoy it, and then we have to move afterwards. So today we are going to talk about protective equipment, and we'll get started. We are going to have 2 videos today. I'm throwing an extra video in that is an overview of protective equipment. So we thank you for being present. Don't forget that you can raise your hand in the platform so that you can ask a question, or please type in the chat any questions, and Brenda are on, so they will see any of those questions that come in, as well as you are free to unmute and ask questions or volunteer responses when we ask you to do so. Today we're going to talk about PPE, and we'll talk about what PPE is and how it works for infection control. And then we'll focus on one specific piece of protective equipment, and that's eye protection. In the next session, next Friday, we'll get a little deeper into other pieces of protective equipment. So please, as Brenda has already asked you, if you would please in chat, introduce yourself with your name, and this time add a little bit more. What is your role within your organization or area of your organization that you work? These kind of help us get a better understanding of who you are, what you do with your organization, and how we can better help you with your needs in your role. Are we seeing anything about specific roles in chat?
Let's see. From Futures Unlimited, we have a whole group, and they are all supervisory staff within the adult IDD day program.
Okay.
And then we have, and Tanya's from a district hospital, and she is acting as a new IP.
Okay, great. Welcome.
And then we have a quality control officer and a COF of training services and IDD services. And then we also have some direct support professionals and day-to-day operation management of crisis stabilization. And we also have some case managers and mental health techs that they oversee. We've got a good group today.
Do have a good group, and I hear a common theme, disability and behavioral health. So those are both very challenging settings to work in, and PPE is particularly important for some of you, and also particularly difficult to manage in the settings that you work in. Thank you for that, guys. So how would you define PPE? We've talked about what it is, but how would you define, what does PPE stand for? Putting y'all on the spot.
We do have one comment: personal protective equipment.
Great. That is correct. And when it's used correctly, it can help stop germs from spreading between you and other people in your facility, including patients, visitors, and coworkers. And I'd like to go ahead and share a video that is a general video, and bear with me as I move to that particular video. We're going to hear from Dr. Carlson on just a general education. Oops, got to move it over.
Hi, everyone. Welcome back to Inside Infection Control, our video blog here at CDC's Project Firstline. I'm Abby Carlson. It's wonderful to have you back. Today, we are going to talk about a straightforward but very important question. What is PPE? We use it, we talk about it all the time, we worry about it, we worry whether we have enough and what kinds we should use. But what do we mean by PPE? What is this? PPE is the abbreviation for personal protective equipment. It's the gear that you use to protect yourself and keep yourself from getting exposed to something that can make you sick while you're at work. Many jobs actually have PPE. It's not just in healthcare that we have this. One great example is a firefighter. They use equipment to protect them from the hazards at their job. A helmet to protect them from things falling down on their head. They might use gloves, boots, and a uniform or a pants and coat to protect them from heat. They might protect themselves from smoke with a mask. All of that is personal protective equipment, or PPE. In healthcare PPE, we use PPE to protect us from things in the environment, and our most common problem, germs. So the unique thing about PPE in healthcare is that it actually serves two purposes, and both of those purposes are really important. One part is to protect you, but the other part is to protect your patients and coworkers from germs that you might be carrying. So for example, when you use a mask, you're not just protecting your nose and mouth from things that you might breathe in or germs that might be, in the air that could make you sick. You're also keeping out germs that you could be breathing out from reaching other people or reaching the environment. Another great example is when you use a gown and gloves. You're not just keeping germs off of your hands and your clothes and keeping yourself clean. You're also keeping any germs that you've gotten on your clothes, on your hands, from spreading to other people, other surfaces, and spreading around as you do your work. You can see from all of that why it's so important to use your PPE and use it right. But even though it's really important, we have to remember it's not magic. It's not the only thing you do. In fact, it's one of many tools that we use to protect you in your daily work to avoid being exposed to germs. So we use other things like barriers, telemedicine, improving ventilation, good cleaning, and good disinfection practices. But when those things aren't going to be enough and you have to interact with your patient to provide good care and there's risk of spreading germs, you want PPE to reduce that risk both for you and your patient so that it doesn't spread between the two of you. Also remember, we like to say PPE doesn't have a brain. It doesn't have a mind of its own. It relies on you, your brain, your mind, to think about how to use it and use it correctly. So think through using your gear, what you're using, how you're using it. Is it the right time? And you have to go through that process every time to just be sure that you're protected, you're protecting your patient as you're about to go do your work. We'll talk more.
Okay, so we talked about PPE, and I kind of let Dr. Carlson define it for you or for us. It is important. Can anybody, the biggest thing is understanding when to use what type of protective equipment. So does anybody want to share with your role what the most important form of PPE is that you use and how you use it?
While we're waiting for those to come in, right as you were starting the video, we did have a comment about PPE and what that is, and it described as clothing or equipment designed to reduce exposure. So I thought that was a great, response. And then our video covered that as well with our firefighters and how they have clothing that's protective as well. So I thought that was a great answer. And then we also had answers for what is PPE, just being a barrier material, and then a mention of the N95s and the other masks, gloves, and aprons.
Great, great. So we'd like to get more specifically into a certain type of PPE and how important it is as far as what types of PPE are, oh, hang on, I'm off on slides here. You guys already know this. It does protect you from things in the environment as well as protects others from things that you may be carrying. And I think Dr. Carlson does a good job of that. And it has to be worn correctly every time. So when we talk about where we are today with COVID-19, which has been our life for, gosh, a year now, or 2 years, almost 2 years now, the types of PPE that are recommended for COVID-19. And today we're going to focus on the area that is highlighted in purple. But we know that we have to wear eye protection, we have to wear gowns and gloves, and we have to wear a respirator. And the difference between a respirator and a surgical mask is that a respirator is fitted to your face and has a higher form of filtration rather than a general surgical mask. So why do you think eye protection is key for COVID-19? Oh, wait a minute, back up. No, yeah. Why do you think, sorry, why do you think COVID or eye protection is important? Go ahead and type in chat.
We have a comment to protect from droplets.
Okay. That's exactly it.
We have another comment that just came in, says coughs, sneezes in particular, and spreading through large droplets.
Mm-hmm. Mm-hmm. And we've all been taught to cough into a Kleenex or tissue or the crook of your arm rather than coughing out into the world. I know I personally still put my elbow up like this, even when I have a mask on. I'm so conditioned to coughing into my elbow now that I am protecting, I guess, double protecting when I have a mask as well as put my arm up. But let's go ahead and hear what Dr. Carlson has to tell us about the eye protection.
While you're getting that video up, we have two comments.
Welcome back.
Oh,
That's
one,
okay. Go ahead.
Yeah, one states COVID is a moist droplet, which is easily absorbed by the eyes. And then the next comment states that the eye protection serves as prevention from any potential diseases. And
Okay, great. So we'll go ahead and listen to Dr. Carlson here.
To Inside Infection Control, our video series here at CDC's Project Firstline. I'm Abby Carlson. It's great to have you here today. Today we are going to talk about COVID-19 and the eyes. You've probably seen that eye protection, either goggles or a face shield, is part of the PPE recommended for COVID-19. But why is that? What do the eyes have to do with anything about this? We focus most of the time on protecting our nose and mouth because we think about the virus getting into those target zones of the nose, the mouth, the back of the throat, and the lungs, and then infecting us. But eye protection is needed because the eyes are another way that COVID-19 can get into those places and make you sick. With eye protection, the first thing you might consider is, oh, we're thinking about splashes and sprays of blood or body fluids that might land in the eye. That's true. That's definitely a consideration. But for COVID-19, we also want to protect our eyes from respiratory droplets because we know those droplets can carry virus and they can get into our bodies through our eyes and infect us. So again, they can reach those target zones in the nose, mouth, and back of the throat through the eyes. How does that happen? What's the connection? Okay, so imagine somebody's coughing at you or even talking at you and some of these little droplets are coming out and they're aimed towards the eye. Well, where do they go? Your eye in its anatomy has a thin, delicate tissue called the conjunctiva, and it covers the inside of your eyelids and part of your eyeball itself. And that is a mucous membrane. So it's like you have inside of your nose and your mouth and other areas of your body. And its job is to keep the eyes nice and protected, and it needs to be hydrated to do that. And so it protects both the membrane and the eye itself. that conjunctiva is covered by a liquid, okay? That liquid are essentially your tears, and that protects your eye and keeps them healthy, making sure they're working correctly. But your tears aren't just salty water. They're actually part of your body's natural defenses, your immune system. They contain chemicals and antibodies that help protect your eye from things that get into your eye, like germs like bacteria, funguses, even viruses. Your tears do a really great job of protecting your eye most of the time, but some things like COVID-19 can get into the eye and cause problems, and that's why we need an extra layer of protection with a goggle or a face shield. Okay, so that liquid, all this liquid is being produced to keep your eye nice and hydrated, nice and wet, but where does it go? Because it's being made every single day. Well, it travels through your tear ducts. So your tear ducts sit right here at the corners of your eyes by the bridge of your nose. And you can see them if you look in the mirror, you'll see a little pinpoint dot where they open up and they connect your eyes to the nose and the back of your throat. There's actually a little drain that travels in there. And all that liquid that your eyes are making goes down that drain and gets drained out through the back of the throat. This happens every single day and is a normal process. And you can think about it when you think about yourself crying, right? You know that your nose runs. Well, some of that is because some of that water that you're producing when you get tears is traveling down those tear ducts, down that drain into your nose, and you have your nose comes out the front, it runs, that's your tears draining out. All right, so the things that land in your eye, like these respiratory droplets we talked about with virus in them, they can hit this eye system, they mix with the liquid in the eyes, they travel down those drains and into the nose and the back of the throat. When the virus gets those places, the nose, the throat, the mouth, it can find cells that it can hack into and cause infection, and that will make you sick. Now, not only that, but it could also infect the eye directly. So we're learning more and more about this, but we found that there are cells within the eye that the virus can also hijack, can get into, and cause infection. They're certainly not the only virus that can do this. One that's really familiar to everybody is pink eye, where you get a nice red inflamed eye, it's itchy, it hurts. That's caused by a virus, and it's the same thing. It hijacks into a cell and causes infection. COVID-19 doesn't cause those same symptoms. It doesn't make you feel the same way, but it still can get in those cells. It still can make you sick. So we worry about that too. All right, so it makes sense with all of that we would want to protect our eyes on top of protecting our nose, our mouth, and our throat when we think about it this way, when we think about respiratory droplets. At the same time, while we're protecting our eyes, just a quick note, you want to make sure that you can still see correctly. So however you choose to protect your eyes, make sure that you're still able to do your work and see what's going on. We'll talk more about other PPE in future episodes. We're also going to have some additional pictures and tools for you on our website and in the comment section as we go along here. So do feel free to follow up with us either on Facebook, Twitter, or on our website, cdc.gov/Project Firstline.
Okay, so I don't know about you guys, but that is definitely a she did a nice job. She explained what eye protection was. I thought she did a really nice job on my slides are not advancing, so bear with me. She did a nice job of explaining what the anatomy of the eye was, and I think that was a good video. So when we talk about eye protection and why it's recommended for COVID, we know that it can get in through your nose and your mouth and your eyes. Have you ever, I know all of you have stood talking with someone and they are someone who spits when they speak, and you feel the spit hit your face. So, and you kind of want to go, but you refrain from it. But sometimes you almost have to. And working with the populations that you guys work with, you can get someone who has copious oral secretions, and they do spit, or those secretions end up in your face at some point in time. So you guys totally understand, but we do have to make sure that we use protective equipment appropriately. And remember, when you are in an environment where you feel like you are encountering a lot of secretions that could potentially end up in your eyes, talk to your managers and make sure that you get the right kind of protective equipment that you need to deal with those patient populations. If you have any concerns about your eye protection at work, have that conversation with your managers. They can help you problem solve and move through some of those things. And like Dr. Carlson said, whatever you use to protect your eyes should allow you to see clearly. So how is eye protection used at your workplace? And what does your workplace do well? Feel free to type in the chat. I can add the third question. What strategies could you use to suggest improvements in your particular work setting? Do we have any comments? Or is everybody quiet on this one? You're all thinking hard.
Yeah, no comments as of yet. Oh, we just had one pop in. And it says that we have safety glasses and goggles that are available to everyone who has a need to enter in precaution rooms as indicated.
Okay. Prior to COVID, did you guys experience any clinical settings in which you felt like you needed to have eye protection? Now, having heard how important eye protection is.
We have another comment that we are a 24-hour crisis unit, and we have cleaning protocols that are done each shift. Plus, they have all the PPE options for our staff, including face shields.
Okay. Was that equipment available to you pre-COVID?
The person who posted that one said that only basic PPE was available. And then we have other comments that gloves were available prior and cleaning chemicals.
So
and then someone did post that, yes, they were available, but it wasn't stressed as much for the use. So I thought that was a great comment.
So knowing that, you know, as we hopefully move through what we have currently going on with COVID, do you see yourself, knowing what you know now about the spread of germs and secretions, do you see yourself potentially using that equipment more frequently than you did maybe previously? Most definitely. I like that response. Yeah. You know, we have learned a lot through COVID. COVID has taught us a lot of what we thought we knew, but it's that we weren't using appropriately or that we weren't using enough of. So I think when we talk about moving past COVID, that is something that we need to continue having at the forefront. When you need the appropriate equipment, you need to use it. And, you know, it's like years ago that you know, we didn't, I'm old enough, I'll fess up here, I'm old enough that when I started in my clinical career as a nurse, we didn't have standard precautions, you know, and you put protective equipment on as you felt you might need it. It was always there, but it wasn't routine to put, say you had to go empty a Foley bag. It wasn't routine that you put on a pair of gloves before you went and emptied a Foley bag. But and as the awareness of bloodborne pathogens and things has happened, I personally went from an example. One day I was driving from one hospital to the next somewhere in Kansas, and there was an accident. And in front of me, I'm recognizing that there's this car sitting somewhere. That car doesn't belong there. And then I realized, oh my gosh, that's an accident that just happened. So being a nurse, I stop and I go to the car. There was another car off a distance, but it was the car right in front of me that I went up to, and there was blood everywhere in that car. And in my brain actually said, oh my gosh, I don't have any gloves. And then the next thought, I looked at my hands and thought, okay, I don't have any open sores or cuts on my hands. And I went ahead and dug in and did what I needed to do at that accident scene. And fortunately, somebody called 911 and we got people there. But, you know, it wasn't ingrained in me before that to think gloves first. So that evolution, as you learn about pathogens and how they spread and what type of equipment is available and how that barrier protects you, you become much more proficient and regularly use it. And of a note, I never went without having gloves and 4x4s in my briefcase when I was on the road, because I was able to use those things or needed those things at the time of that accident. So, and I even carried an airway for a while. So there you go. Incidental, but you think about that protection and how you would use that protection. So when we think about what we've learned today and what we've learned in the past weeks, what questions do you still have? Take a minute to think about that. And do you have any questions?
We have a question about are you open to any questions is what this is asking. So do you want a question about what we covered today, or are you willing to take questions over whatever is pressing them at this moment?
We can answer any questions, and if you can't answer it, we can get the answers for you. So go for it. And feel free to unmute and ask them audibly if you want to. Hopefully by now you've learned, you've figured out that we will try and answer questions to the best of our ability or get the answers for you. Must be a long question.
Okay.
Okay.
Most of the question relates to how the mandate develops or not, but that remains in the courts. So more kind of an update on what we know with mandates. The next question or statement. I think this is the new normal from here on out. So we will have to keep this type of cleaning protocols and SOPs in place to reduce the spread of germs and viruses and protecting patients and the staff the best we can. I think that's an excellent statement.
Absolutely, that is excellent.
Our question goes back to what we know on the mandate.
You know, the mandates, with respect to the mandates, there have been injunctions to stay the deadlines. I think it's in our best interest to, in the background, go ahead and be developing those policies and getting our ducks in a row, because I believe that if they don't stop it completely, it will come back in some form of modification, or it will be oh, it went today. And the expectation will be that we have those things in place. And you know, it really is key that we continue to utilize the practices that we know will prevent spread of any organization or any organism. It's not just COVID that we need to be cognitive or sensitive to and work to prevent. You know, we learned a lot. We learned what we didn't have, what we needed to have, should we need it. Our organizations are all held to having some kind of emergency management plan. And those emergency management plans should include the things that we've learned through this pandemic that we needed to have for our own protection and the protection of our client base. So I think it's prudent to have those things ready to go. Talk in your organization. You guys can implement what you need to implement and you feel comfortable with. So it doesn't have to have a mandate to do that. You know, many hospitals and organizations have already gone ahead and put mandates in place that are conditions of employment, not, you know, fed by the feds. They did it ahead of time because they wanted to protect their populations, both internal and external. So I don't know if the two Brendas have anything to add to that or not.
I will say that I'm following it very the best I can for my long-term care folks. So I know you guys fall under a different, you know, kind of regulation there with that, but I do know even with the stay that has now, of course, been spread across the nation, the trade associations for the long-term cares are still encouraging you all to follow as if the mandate were to come into play. Just because, as Nadine stated, it could come back here in January and be like, should have been ready January 4th. And so we do need to be prepared. I just want to caution all of you, if you are, you know, following the state guidelines, you are doing your religious exemptions, we need to make sure you have counter efforts in place. So what are you going to do for those folks that you have allowed exemptions for? Because you do still need to have some sort of PPE and testing strategy in place. And so with this stay, gives you a little bit of time to look at that. I would really, really stress that each of you look at that policy, how you plan to handle those that you are approving exemptions, because it doesn't stop once you get the signed exemption. You guys all do have an obligation to still keep the people you serve and your staff safe.
And I noticed one of the comments that flashed had something to do with flu. I didn't read the whole thing, but we, you know, we know that we had an almost non-existent flu season last year because we were stressing hand hygiene. We were wearing face masks, and influenza is a respiratory droplet shared disease. And we already have a heads up that the flu season this year could be particularly virulent. And you guys all know that the flu vaccine, or should know that the flu vaccine is a hit or miss. And but we do know that organizations who have put influenza vaccine policies in place for their staff have had, you know, we have one organization here in Kansas that has had no influenza related deaths in the 3 years that they've had a flu vaccine mandate. So, you know, that speaks to me. That is something that would be reassuring to me if I had a family member in that particular care setting, because I would know that they're doing everything they can to protect my family member from getting influenza, which could take them out. So, and we're seeing lots and lots of RSV and rhinovirus and other things that are all spread respiratory wise. So keeping those strategies in place are important. And there was a compliment, thank you, who said that suggestion was valuable that Brenda gave you. I do know that we are 3 minutes over time. So key takeaways for today are that PPE is used in healthcare both to protect you and to protect others. Eye protection is recommended for COVID because the virus can enter the body through the eyes, and whatever is used to protect your eyes should allow you to see clearly and do your work safely. Again, here's the resources that you can get to learn more and be able to share more. And if anybody ever wanted a conversation about how to use this in your organization, please reach out. We can help you put together a program to use the Project Firstline resources and make sure that you know how to access them. We'd be more than happy to do that for you. So reach out to us, ask us how to go with that. And that's all I have. I thank you for the great discussion we had today. And we'll see you next Friday. We'll talk more next Friday about another form of PPE, and that has to do with the gowns and gloves. And then our last session, I believe, unless we want to extend it, is going to be about environmental cleaning. But thank you all.
Thank you all. Thanks, Nadine.
Yes, it was a good call.
Bye, guys.
Bye.